listening to Hard Talk Grenada. A very special good morning to those of you joining us on 97.5 City Sound FM, 89.5 CR FM, 91.9 and 91.5 Real FM Radio, the realest FM in Grenada, 92.9 Sister Al Radio broadcasting from Hillsborough, Carriacou, and 94.9 We Noise Radio out there in Brooklyn, New York. A very special good morning to those of you joining us on the live video, whether it's on Facebook, it's on YouTube, it's on Instagram, wherever you are joining us. Good morning to you. It is a beautiful, beautiful, beautiful Tuesday. I have to make sure I say Tuesday because this morning I said Monday. It's not Monday, it's Tuesday. A beautiful Monday morning inside the Spice Isle. It's been a very interesting weekend, if I might say so myself. A lot has happened, but that we will discuss on another day. This morning is a very important morning because with me in studio, as some of you can see, I have two very beautiful young ladies, and they represent the Island Health Services. Did I say it right? Island Health Services. And they're here this morning to talk to us a bit about, I'll let them tell you what they're here to talk about, and I'll give them an opportunity to introduce themselves. And we'll start with Miss Batiste. Good morning.
Good morning. Good morning, Miss Duncan, and good morning to all your listeners.
All right. And just give us an idea of who you are. But before you do that, I don't think my audience can hear you. So can you pull the mic up? There we go. Okay. All right. Good morning.
Good morning. My name is Natalia Batiste. I am currently attached to the Island Health Services, where I am the public relations and marketing manager. Mm-hmm. Today, we're just here to introduce a new clinic that we have started as of August 1st. It's a renal and chronic disease clinic. Mm-hmm. So we will no longer only be doing dialysis. We are also now offering services to the general public for renal and chronic diseases.
Okay, and renal, and when we speak about renal, we speak about kidneys, right?
Yes.
Good. So when we say chronic disease, we don't mean all chronic diseases,
no.
Cancer and so on. We're speaking about
chronic diseases associated with kidney disease.
With kidney disease.
Mm-hmm.
All right. And I know it's your first time. I promise that I will be as accommodating as possible to kind of ease some of those nerves. And next to her, the very pretty young lady who's very quiet in the corner there. Please introduce yourself.
Pleasant good morning to everyone, all the listening public. My name is Danola Maxwin. I'm a psychologist by profession, and here I am today with Ms. Batiste, just to lend my voice to helping people to become more aware and understand mental challenges or mental health challenges in the general sense, but specifically when you're dealing with chronic disease such as kidney disease.
All right. And I know it's your first time too. So I'm going to ask you the next time you speak, just speak a little closer to the mic. And it's a pleasure having you guys here with us this morning because I know that the kidneys and kidney disease and renal failure is something that is a big topic now here in Grenada, and how we handle it. I know you're going to talk about the ins and outs of the clinic itself. And tell me your name again because I don't want to say it wrong. Danola, you're going to talk about the
mental health.
The mental health, dealing with the chronic disease treatment, understanding. Okay, yes, wonderful. So give us Ms. Batiste, give us a little insight on the actual clinic and what it's about, a little bit of history surrounding it.
Okay, so Island Health Services has been providing hemodialysis. So there's two types of dialysis on Island, and we've only been associated with hemodialysis. So over the past 15 years, we have noticed the need for a renal chronic disease clinic, because most of the times we see patients only when they're basically at end stage, when they're being placed on dialysis, and at that point, a lot of them are critical. So we saw the need to implement this clinic so that we can try to avoid patients getting to this critical stage, or try to see if we can help people not get to kidney disease. Because you can have a chronic disease such as diabetes or hypertension, which is, as most people would know, high blood pressure. You can have one of those chronic diseases and not get kidney disease, right? As long as it's monitored appropriately and you're on the proper medication, proper nutrition, you can have a disease, one of those diseases, and not get renal failure and end up on dialysis. So we're trying to avoid, or we're trying to help to see if we can get a lot of people, catch them at early stages of their diseases, or monitor high blood pressure, diabetes, and see if we can get them not to get to renal disease, right? So that would be the purpose of this clinic.
Right.
Where they would come in. For now, the clinic is only offered on Saturdays by appointments only. So you call the clinic, you call the dialysis clinic at 439-9474, or you can message us on Facebook to book an appointment. The appointments are only available on Saturdays, unfortunately, because we are trying not to, because of COVID, due to COVID, we don't want to mix dialysis patients with outpatients. Right? So we have to kind of, as you say, shield or protect our dialysis patients, because they are susceptible to the coronavirus. So we're going to keep the clinic on Saturdays for now, where you book an appointment, you get a consultation with the doctor. The doctor will run some blood work on you to see how is your kidney function, check your blood pressure, your blood glucose, monitor all those things. We also developed what we call a renal card. So that card would stay with the patient, and all your blood values and your blood glucose, your blood pressure, everything would be registered on that card, so that if you go to the hospital or you go to another physician, they would be able to see what your values are, what your blood pressure is at, what your blood glucose is at, so that they would know this is what you were a week ago and this is what you are today if they run new blood work and so on.
So the clinic is really designed for people who need screening, not people who are already on, and this is a new chronic disease renal clinic. That is meant for people who have not yet been screened, who need to be screened. Let's say you have a history of high blood pressure in your family, a history of diabetes, and you want to get screened to make sure that your kidneys are okay, that they're functioning properly, then this clinic serves to do that.
Well, it is also for people who have already been diagnosed with renal failure, renal disease, because there are 5 stages of renal disease. And if you're in stage 1, stage 2, you already know that you can also come to the clinic, where we would see what diet plan you're on, what medication you're on, if it's working for you, if your blood pressure is responding to the medication you're on. So it's mainly for people who have a chronic disease such as high blood pressure, diabetes, or polycystic kidney disease, which we have we have a couple cases of that on island, where we had a lot of some of our patients have polycystic kidney disease, and we have to remember a lot of these diseases are hereditary. So if your mom or a sister or family member would have had one of those diseases and they ended up on dialysis, or they probably didn't even end up on dialysis, you need to check yourself. Right? Because it is hereditary, and you can't just say, well, my sister had it, but I'm not going to get it because I feel healthy. Right? So the clinic is also for people who already have been staged with renal disease, or it can be for ones who just have high blood pressure or diabetes and they want to get themselves checked out and see if they need staging, if they have kidney disease. So it's going to be for basically anybody.
It's for both.
Yeah.
Okay, I understand. And let's talk about the dialysis that you guys already provide. Now, there may be questions out there that, well, the hospital also does dialysis. Now, I only, in speaking to you recently, understood the fact that there are 2 different types of dialysis that you would do. Can you break that down so we have a clear understanding of the difference within of the 2 dialysis?
Yes, so there are 2 types of dialysis. There's hemodialysis and there's peritoneal dialysis, which we would call PD, right? Hemodialysis is where you get hooked up to the machine. You come to the clinic, you get hooked up to the machine, and the blood comes out from one needle and it goes back into another, right through the machine and back to you, right? So that's where we use an artificial kidney to do the job that your kidney is supposed to be doing.
Okay.
Right? But then there's PD, and currently I believe they have a clinic at the General Hospital that does PD. But PD is basically peritoneal dialysis. They can teach you to do it at the hospital, and then you can go home and do it.
Okay.
Right? It's more to do is where you can educate the patient on how to do it. It's not hooking up to a machine. It's just a fluid,
Right.
and a catheter placed. So we don't offer that service.
Okay.
We currently only offer hemodialysis.
Hemodialysis. And tell us the because you said there were different stages of renal disease. At what stage? Well, we know that 5, of course, would be the most critical
end stage, yeah.
That's end stage. And at what stage normally do you see people coming into your clinic?
At end stage.
Wow.
That's when they have to be placed on dialysis. And most of the patients we get, they come in at end stage and they're critical. So we see them when they need dialysis like emergency. Like they have to do like a couple treatments back to back so that we can stabilize them.
Okay, and let's talk about costing, because I know everybody's out there probably wondering, what is the cost of this? What is the cost of one treatment?
It's $695 EC per treatment, because a lot of people would say that dialysis is expensive, and anybody who would travel would know that no matter where you go, dialysis is expensive.
Right.
It's not only the fact that we're just hooking up someone to a machine, it's all the different things that add up, right? Because you have to make sure that these machines are properly maintained. We have to test our water system every day,
Right.
because a dialysis machine doesn't just plug into a wall and work,
Yeah.
right? You have to have a reverse osmosis machine where it strips the water. You have to be testing the water. You have to test the machines, service the machines, and even just to service our machines, we have to bring in a technician from Trinidad.
Right.
So if one of our machines break down, we have to fly someone in, put them in a hotel, have them fix the machine. Hopefully it takes a day or two, sometimes longer.
Right.
If the machine needs a part, then that's another issue. So it's quite expensive. The supplies you have to hook up to the machine, the staff, everything, it comes together. So that is an expensive service no matter where you go.
Okay. And how have your patients been managing so far in terms of, because we do have an issue here with in medical fields where a patient comes, they get treated, they're given medication, they come once, they come twice, and then you don't see them anymore. How has that been for you in terms of follow-up with your patients, consistency in terms of treatment and so on? How has that been for you guys at the clinic?
Well, basically with the dialysis is that it's not like they can come and have a consult or a treatment today and not come next week, because they know that if they don't get their treatment, it's going to be fatal for them. Our patients are actually very well. Like they come for their treatment twice a week currently. They know their days. So if we split them into groups. So we have a Monday, Thursday group and a Tuesday, Friday group. So they know their days. They have a schedule. The nurses would create their schedule with their times they have to come. And they do very well with coming for their treatment and with their medication and so on. We all know that they face a lot of challenges when it comes to finances, because it's not only them paying for dialysis. You have to remember that renal failure patients would be hypertensive, diabetic, and they would have other chronic diseases. And you remember, once one organ stops functioning, it puts strain on the rest of the organs,
yeah.
right? So they develop other problems while on dialysis. And it's quite costly because they have to keep up with a certain type of medication. They have to keep up with their dialysis. They have to keep up with their nutrition. So it's what we would call a new way of life for them.
Wow.
And it puts a lot of strain on them financially, mentally, you know. So recently, Island Health Services, we have seen the need for a more holistic approach. And we have now on board a nutritionist. So she would meet with our patients and go through their meal plans. We have the doctors on board where they would see the doctors and they would go through their medication and so on, make sure that they're getting the correct time of treatment, amount of hours of treatment, they're on the proper medication, it's actually effective, and so on.
Okay. Now, since we're on the topic of the psychological effects, I'll go across to you and let's talk about how kidney disease affects one's psyche. We know that any sickness really does affect you, in a physical way, but we never really talk about the mental strain that something like this puts on you. Tell us a little bit about your job and how you fit into this whole scenario.
Okay, so this area is very new in terms of looking at mental health and kidney disease. However, mental health is basically, it encompasses both your emotional, psychological, and social well-being, right? So our mental health is very important to our everyday life. We know that and in a general scheme of things, we all have some challenges daily, some stress, some anxiety, etc. But however, when you put that into someone who's dealing with a chronic disease such as kidney disease, studies has shown that depression is one of the most common factor in terms of people who suffer from kidney disease and in terms of the mental health. So what we're trying to do now, as Ms. Baptiste said, that IHS is trying to create a more holistic approach. So when they're looking at screening people, or even the people who are already on dialysis, we want to be introducing that access to mental health services where you can learn about your mental health, because a lot of people more focus on the physical aspect of their health and they don't concentrate on the feeling, because it's how you think, how you feel, and how you act.
Right.
It affects all those aspects of your life. So when you put into the context of dealing with a chronic disease such as kidney disease, it's a whole lifestyle change.
Right.
Everything changes. You have to switch, as she said, your diet. You have to switch everything. But some people, in terms of the mental aspect, they're not able to cope or to manage how they feel, or sometimes they tend to stay away from associating with people or talking about how they feel. So we're trying to help them to understand that it's okay to talk about how you feel. It's important actually to talk about how you feel. It's not something that you shouldn't talk about and figure that, okay, well, I'm suffering, I'm sick, and I don't want to burden anybody. It helps more to help you to remain more positive when you can talk about your feelings. So, like Ms. Baptiste also said, things like finance, when somebody have a disease such as kidney disease, sometimes they can't walk anymore.
Right.
So they have no access to income. They are dependent on family members. They have to worry about how they pay for the treatment, etc. That will be a stressor. They have other stressors like the physical aspect of how they feel in terms of pain, in terms of suffering.
Right.
So all that affects your psyche. So we're trying to catch people to be able to tell them that, okay, there are mechanisms you can put in place to help build your emotional resilience. So that you can, because there are stages that people go to, everybody is different, yes, but when you get the news that you're dealing with this permanent disease that you have to deal with every day, it's hard. So you have to be able to yes, feel how you feel. That's okay. If we all have low moods, we all have times when we're down, we might get a little anxiety over different things, but it's how we regulate those emotions and try to manage it. And because as human beings, we are prone to more the negative aspect and the negative thinking of things.
Yeah.
And if we stay in that zone, then it's detrimental to us in terms of our physical health, affects our mental health, and vice versa, basically. So people with chronic diseases like as kidney disease, they might fall into depression or anxiety, and then they don't know how to deal with it, they don't talk about it.
Yeah.
Then even like self-blame, like, you know, our burden, they will think, okay, I'm a burden on my family. All those things will affect them in terms of their mental health. So they have to be able to talk to somebody. They have to be able to have support from family members and even professionally. At least that's what IHS is trying to do. So you make that service accessible, so you can come in, you can talk about how you're feeling, or you can be an assessment can be done where you can test your stress level or whatever it might be, so we know that, okay, this person is going through a very difficult time, and like with stages, you catch them, so you can go through a stage where you're stressed out, you're worried, you're anxious, and then you start not associating with people, not socializing, not your behavior change. You might just want to stay in bed all day. And some people might figure, okay, well, I don't have money to deal with this, but I just forget about my treatment and just, you know, that's where you have the thoughts of suicide. It basically comes in.
Yeah.
You understand? So there have to be this avenue available where you can, you know, okay, it's okay to talk about how I feel. It's normal. It's normal. It's a normal part of life. It's just learning. It's okay, but I have to learn now to manage those emotions and the behaviors that may come with it.
You know, it's funny that you would mention talking about how we feel, because it's a taboo. Talking
is,
about
yes.
how we feel, expressing how we feel, we see it as a taboo. We don't like talking about. I don't want nobody to know my business, you know,
Yeah.
or I don't feel like I want to talk about this, or the general statement, a good man, you know.
Yeah.
And inside we really burdened with a lot of stress, and you know, I think it's an education issue where we need to start educating people to identify when somebody is really stressed, or when somebody just needs a shoulder to lean on, or
Right.
when it's maybe not even an issue where we need to have a conversation about it. You just need some company.
Yes.
You know, you need somebody to make your day better, you know, something like that. And I think we need to start educating people on these things, because I can only imagine, Ms. Batiste, the kind of stress that some of your patients would go through as a result of this disease that they have, but on top of it, COVID-19, and having to worry about, listen, if I catch COVID, that
it.
might be the end for me, you
Yeah.
know. So I can only imagine what is going through their minds, and I'm supposing that you guys provide that sort of emotional support for them, in terms of them knowing, okay, well, we can go and we can talk to these people, and they're listening to us, you know. But it is something that I think needs to, and not just for Ms. McSween, not just for kidney patients, but on a whole.
In the general sense, yes.
In the general sense,
Yes.
we need to learn to support each other more, to be able to look beyond just how we may feel about a person or feel about a situation, and think more about, if this were me, you know, put myself in that kind of
Yes,
position.
to be able to show empathy for
Empathy.
others. Yes.
You know, and I think it's a really good initiative that IHS is putting together, where you now have for kidney patients, where you can go, you can get your dialysis treatment, but apart from that, you have doctors to consult with. You have a dietitian, a nutritionist who would come and sit with you and speak to you about what you can and cannot eat, and what you should avoid, and portions, and all of these things. And then you also have a psychologist who you can speak with about the emotional factor of it, how you feel, how this makes you feel, what pressure or strain this puts on your mind. So this really is a great program. For the screening, though, I want to get more information on the screening, because a lot of people don't realize that they're at, or they have kidney disease, until it's too late. Is that the case? Because I could be misspeaking on their behalf, but is that the case, or is it a case where people are just negligent to the fact that this is something that really exists and can really affect my life?
I think I think for most people, I think they don't know, like they know they have a chronic disease. So a lot of people would know, okay, I have high blood pressure, or I have diabetes, right? But they wouldn't follow up with their physicians on if my medication is working. Because there's some people that they have hypertension and they'll be on a certain medication, but their blood pressures are still high.
Right.
Which means that the medication is not effective. So
Right.
you should go back to your doctor and say, well, I'm taking the medication as you prescribed it, but my blood pressure readings are still within this range, and I know that is high. I think a lot of it too is education. Us, like if you go to the doctor, educating you on what is happening to you.
Right.
Because a lot of people would just say, yeah, I have high blood pressure, let's just drink some bush. You know, we have a lot of people who would tell us that.
Yeah.
I would just drink some bush and it has helped me, or, you know. So the clinic now, we're hoping to catch a lot of people with chronic diseases before they get to kidney disease, right? But if you already have kidney disease, this would also be a clinic for you, okay? So once we get started with that, and we can monitor your blood pressure, monitor your blood values, your kidney function, and so on, we can put you on the proper medication. We can monitor to see if this medication is effective for you, because the medication, we could be on the same medication, but it might work for me and not for you. Also, change nutrition. We need to work with you on a nutrition plan. We also talking about the psychological effects of all of this happening to someone. They need someone to talk to just the same.
And sometimes, let me just say here, sometimes it would be that the patients would think that they might be having certain feelings, feeling depressed or feeling sad or whatever, anxious or whatever, and that might just be a cause of the medication they're taking, and those are some of the side effects. So it's also important for them to talk to their doctors and let them know how they're feeling, so the GP can do an assessment of, okay, rule out the fact that, okay, you're on that medication, but it's not supposed to make you feel like that, or at least for this long a period. So
Right.
they know, and they can advise them to, you know, seek professional help, like to talk to someone.
Right. That is important, huh?
Yes.
That is important. And you know, I never thought of that, because sometimes we look at the psychological effects of something and think it's related to how we feel about the disease, and not
Yeah.
necessarily the medication
Exactly.
that we are taking. But what you brought up is a very important point. Speaking to your doctor so that they can assess if the medication is working or not. And also, we are in a culture, and I mean, I think everybody is cognizant of that fact, where we like to drink bush. I
Yes.
mean, we understand the benefits of drinking our herbal medicines and so on, and not that it's bad, because it for some people it works.
Yes, it
for some
does.
people, they take their herbal medication and it's important and it works for them. But then there are other people who may do the same thing, and the results may not be the same. And I
Yeah.
think it's important for that conversation to start happening, but also important for us to start having the conversation about mixing bush and medicine. Because no, we do it. We
We do.
feel like the doctor gives us a certain medication, and somebody say, well, you know, if you drink this bush for that, it'll work in it. So we take in the medication still in it because we want it to work, but we also take in the bush because we want that to work too. So we
Yes.
want both of them to work. We take in both of them at the same time, but we don't understand the impact that the both of them may have on each other.
When they mix.
One may be causing the other one not to work, you know, and it may be delaying the effects of, or when you're supposed to recover. In the same breath, one may be causing the other one to work too good, you know, so it's putting even more strain on your same kidneys.
Yes.
You know, so we definitely do have to think about that. But Ms. Batiste, I want us to talk about the role of the Kidney Foundation in what you guys do, because from my understanding, you guys have a partnership with the Kidney Foundation that allows you to I'm not sure, so just give us an idea of what happens there.
So the Kidney Foundation functions basically for the patients. They, as an advocate for the patients, they raise funds and they would assist patients with payments for treatments. The Kidney Foundation is separate from the clinic.
Okay.
Okay, they're a whole different board to the clinic. So they basically go out, they reach out to the public, and they try to raise funds, and they would assist once a patient comes down with chronic renal disease and they're being placed on whether it's hemodialysis or peritoneal dialysis. Once a patient reaches out to them, they would assist the patient with treatment cost.
Okay, and some of the cost is also subsidized by the government.
Yes. So the government would pay per patient every month, and that would go to the Kidney Foundation, and then the Kidney Foundation would tally that with their payment and then pay to the clinic.
So you guys don't receive any money in hand apart from what the patient themselves pay?
No, we don't.
Okay, so everything goes through the Kidney
Foundation.
So if someone wanted to make a donation, let's say to pay for the treatment of one patient, or to pay half a treatment, or if that's even possible, or donate towards the payment of a treatment, they would have to go through the Kidney Foundation.
Well, if the person is paying to a patient that they know,
Okay.
they can come to the clinic and say, I'm making a payment to this person's account.
Okay.
Once they know the patient. But if it's I just want to make a donation to dialysis patients, they have to go through the Kidney Foundation. The clinic is a private entity, and we try to stay away from accepting donations from the public for dialysis.
Well, direct donations.
Direct donations, yes.
Okay. Now, as it relates to your patients, so far, how many patients have passed through the clinic?
From the beginning?
Well, if you can give us
I wouldn't have a number
an
for
average.
you from the beginning. We've had quite a few, and as I said, we see the patients at chronic renal disease stage, where they're at stage 5 kidney disease, and we need to understand that when they get to that stage and they get to us, dialysis is supposed to be just temporary until you can get a kidney transplant. So you're supposed to be on dialysis and basically on a waiting list for a kidney transplant. Unfortunately, in Grenada, we don't provide that service for kidney transplants as yet.
Right.
Hopefully, in the future that happens. But so basically, the patients are just living on dialysis until that time comes.
Now, I know you and we've had this conversation before. You were a technician.
Yes,
And
I
you-
started in 2006 with Island Health Services as a dialysis technician.
Right. Now, I want people to understand, and this is the reason I'm asking the question, how these kinds of situations don't just affect patients, but they affect the people who deal with them as well. Now, you were a technician before, but you moved out of the technical field and moved into, and I know you're laughing because you know the question is coming. You moved into the administrative field, and tell us why that change happened.
And so, as I said, I started with Island Health Services in 2006 when the clinic opened, basically, and I stayed with them for a couple of years, and then I left and I went to another job. The thing for me is that what kind of moved me from the technical aspects of the job is that I couldn't deal with loss. As we were speaking about the mental health issues, mentally it's a lot to put up with, not only for the patient and the families, it is a lot for the staff as well. So actually witnessing someone die in front of you is not easy.
Yeah.
And I don't think it ever becomes easy over the years, and mentally I could not deal with that.
No, and I wanted us to draw this analysis because I want people to understand there are a lot of some people saying that, oh well, people just dying like that, and they're not taking care of these people. And I think I want people to understand that to look at someone die in front of you is never an easy thing.
It's not.
And I don't think anyone in the medical profession would want to see somebody die in front of them, would want to be responsible for the death of someone else, to have that kind of burden on your shoulders. And as a psychologist, Ms. McSween, you have been, I'm sure you've had conversations with people who've been affected in these kinds of ways. How often do you get people coming to you to say, listen, I can't deal with this anymore, this is a hard situation for me?
Quite often, because when you talk about loss, in anything, it's grief and loss, basically. It can be in what Ms. Baptiste is referring to, or any aspect of life, whether it's divorce, whether it's a loss of a job, any loss. There's an aspect there that some people might feel like Ms. Baptiste said, it's overwhelming. She cannot deal with it. So you have to know yourself enough to know what you can put up with in terms of your psychological capacity, because like she said, it affects both the patient, the family members, the people who are working with them. So if you cannot function in that capacity, then you have to be able to step out of it, to be able to regulate yourself.
Right.
So the patients themselves, in terms of loss, if we look at it in the context of, let's say, when they're diagnosed with the disease, they have to go through the stages of now grieving for the healthy lifestyle that they had before, basically. So that is also a sense of loss. They grieve for what they had before. They had good health, etc. And now they're faced with the situation of living with a chronic disease such as kidney disease. And it's not easy, because sometimes you go through stages of denial. You can't believe that, no, this is not happening to me.
Yeah.
You know, you can't accept it. Then you go through stages of bargaining. It's like, okay, Lord, just please, we know we're very good in our faith. Just please, let me get through this.
Yeah.
And then, I will stop doing this. I will stop doing that. I would stop drinking alcohol. I will start smoking. And you blame yourself also that if I didn't used to drink alcohol or smoke or whatever the case might be, I would be in that situation. And some people, very rare get to the stage of acceptance. And getting to the stage of acceptance is a hard thing, even with persons like Ms. Baptiste, who have to deal with the patients, because in that some patients might be able to go, okay, I am faced with this right now and I will have to deal with it. I will just have to change my lifestyle and walk around it. That's patients are people who basically have strong emotional resilience.
Right.
They're able to step up in that way. But for a lot of people, it's hard to get there. Even whether you're a patient or whether you're a technician, a doctor, whatever, a family member, it's hard to get there to the stage of acceptance. So sometimes, and there's no what should I say, there's no measurement or period as to the stage of loss or grief.
Yeah.
Because with loss comes grief.
Yeah.
And you can't tell somebody how long they could be in that stage for. So
Right.
sometimes it affects you for a very long term period, and then it leads to other things like you're getting depressed, etc. So I think a lot of the times patients get to that stage because they've lost their normal lifestyle, their good health, and now they have this permanent chronic disease, kidney disease, that they have to deal with, and they just can't deal with because they have all these other things going on, whether it's financial and all these other emotions going on, and they just can't get to that stage. So sometimes it just makes it so overwhelming and unbearable, and I think that is why we see so much in terms of depression being very common.
Okay. And for those of you listening, we're going to open the lines while we continue the conversation, in the event that you want to call and you want to ask a question about the topic this morning. Remember, the number to call is 440-7377 if you're calling locally. If you're in the diaspora and you want to give us a call, it's 347-329-3101. You can also send us a question via WhatsApp, or you can give us a call via WhatsApp, and you can post your questions in the chat box on the live video. Now, Ms. Baptiste, can you tell us if you guys have ever done a study that determines with the patients that have passed through you, what is the leading cause of renal failure or chronic kidney disease here in Grenada?
Yeah. We have recently started a study trying to find out how many people on island are with chronic diseases leading to renal failure and so on. We will probably come back with numbers concerning that. But for now, most of the patients, let's say 95% of our patient population, is basically been either they had hypertension, diabetes, or polycystic kidney disease. And we have to remember that also with polycystic kidney disease, it's hereditary as well. So we would see a lot of patients who are family members coming through the clinic with renal failure due to polycystic kidney disease. So if your mother had it, then most likely you develop it, and it would lead to renal failure.
Right. And apart from having high blood pressure or having diabetes or it being hereditary, what are some of the other signs that you can look out for just as a trigger, that says, listen, I need to get tested. I need to check myself because something isn't right.
You mean like symptoms?
Yes, like symptoms.
Well, for you mean like if they're disease, like kidney disease symptoms?
Yes.
Well, a lot of people would have like if your kidneys are infected or have you're having back pain, severe back pain, that could be also a sign that something is wrong. You can go check that out. It's like lower back pain and so on. A lot of people, you need to monitor your urine production. You need to monitor the color of your urine as well. Sometimes you can smell somebody and know that they're uremic, as we would say. You would smell the urine in their sweat.
Right.
And a lot of people don't pay attention to these things health-wise until it gets really bad. Because, I realize there's a lot of people here that don't like to go to the doctor, as they would say. Let me just go lie down and I'll feel better later. So these are things that you can also monitor. The color of your urine, the production, the amount of urine you produce. But I'll leave some of those medical questions for the doctor to answer.
and if you guys have questions, we are trying our best to get the doctor to come here to sit and really hone in on what kidney disease is and the thing that the things that you need to look for and the things that you need to look at and so on. Now we also had or is a clinic, I should say, looking into doing a more holistic chronic disease clinic and not just dealing with because I know you guys are a dialysis clinic,
right?
And there definitely is a need for a chronic disease clinic here in Grenada, where persons that are dealing with different chronic diseases like cancer and diabetes and these chronic things.
So our clinic, the Saturday clinic that we're introducing is actually for patients with diabetes, with hypertension, who has already been diagnosed with one of the stages of kidney disease.
Right.
So it is for those people, or if your family member was diagnosed with kidney disease or hypertension or diabetes, you can also come and visit the clinic.
But also, if you aren't diagnosed with any of the stages and you have high blood pressure or you have diabetes, you can come in to get screened as well.
Yes.
Okay, and you guys do all the taking of the blood, the testing, and all of that. Everything is done there.
Yes. So you come in you get a consultation with our doctor. The doctor will draw your blood. The blood will be taken by IHS to the lab to be run, and then the doctor would do a follow-up with you to give you your results. Also, we would offer, depending on what the doctor determines on that consultation, he will also refer you to the nutritionist for a consultation. The nutritionist is also in-house at the clinic. So the nutritionist will sit down with you and say, well, your blood pressure is really high or your diabetes is not under control based on the last consultation the doctor had with you. So we need to have a sit down and chat about what food do you eat and the quantities and so on.
Wow, so that really is a very holistic approach. Y'all have it going on down there,
Yes.
man. We've discussed the possibility of having a health fair because I think it's due time
Yes.
that we have another health fair here in Grenada where people are educated on these different aspects, because based on our conversations, I mean, it's alarming the amount of people that we have here in Grenada with renal failure or kidney disease in such high stages as well, and not seeking consultation before it gets bad, and I think Mrs. McSween, what you spoke about in terms of acceptance is probably one of the leading reasons why some people stay and wait until it's so late before they even seek consultation.
Yeah, because they're in the denial stage for
Yeah.
a long time.
Wow. And I mean, it's sad to think about.
It is.
Because you have so many friends in Grenada. We're so close knit that somebody knows somebody, everybody knows everybody.
Yes.
So when you hear about something, and people at such a young age that suffer with this, and you're wondering, well, am I at risk? But sometimes we get to the stage where we talk about, am I at risk, but then we don't do anything after that.
Yeah.
Yeah.
We're so afraid that if I go get tested, I may find out something that may change my life forever. And we don't want to have to deal with that.
But then that's worse, because if you wait and then it gets there in stage, then it's more costly, because as I said, you can have diabetes and hypertension and not get kidney disease. Once you're monitored and you're caught early and you're on the proper medication and you're on the proper diet, you can avoid getting to kidney disease stage.
Yeah, but
That is true, but a lot of people, because of the anxiety and the fear, basically, some people fear death very much. So because of the anxiety and the fear that they feel, it keeps them from proceeding to the next steps that they have to take in terms of finding out. It's like they don't want to
And
know. They can't. Their mental capacity can't deal with that.
And I think most of it comes down to family as well, because if I know my brother is not well, I will be on his back to get checked out and to get the proper care that he needs as well. Because even with dialysis patients, we've noticed that at the beginning, when they're now starting dialysis, you would see family members come with them to the clinic. Family members would come and bring food while they're on the machine and check up on them and so on. And then as the months go by, the families just phase out. You don't see them anymore. And I think a lot of it with the kidney patients, if they are having any signs of depression and so on, a lot of it has to do with the lack of concern, the lack of care they get. Because it's kidney disease, when they get to dialysis stage, it's not like it's okay, they're going to go for a couple treatments and they're going to be okay.
Yeah.
That's their life for the rest of their life.
Yeah.
Right? So we as family, we also need to remember that they're going through a lot. Mentally, physically, financially, it's a lot on them.
Yeah.
And a lot of the family members don't show enough interest, to me, in the care for their loved ones.
But there's another aspect of that you can also look at too. It is also mentally taxing for the family members.
Yep.
So that's why it's important for the person who is taking care of you, the family members who is supporting you, themselves, to have some kind of professional assessment, etc., because it gets too much, it gets overwhelming. Because think about it, you have this family member who's suffering, who you have to take care of, your whole lifestyle have to change, your routine have to change, whatever the roles are responsible would have been, maybe you have to take over that. So you're working, you're taking care of them, your mental capacity, sometimes you just can't deal with it. So that's maybe part of the reason why you see that in the beginning, where it's a little easier, you have the family member there on hand, but as the process goes along, it's an everyday thing that you have to deal with. Like, it gets harder because they also have their life, you understand? And then it comes back to the mental aspect, that people don't look at the mental capabilities of the mental health. So it's like you're feeling a certain way, and guilt would have a lot to do with it too, because even if you see them not showing up, or sometimes they feel guilty that they're not able to be there for their mom or their dad or whatever family member it might be. So that also takes a strain on them. So it's also important for the family members to access mental health services.
Right, and I was just going to ask that, would the clinic be providing that service as well, where the family members can also come in and speak with the psychologist to get counseling on how they can deal with and how they can make not just the patient's life a little easier but theirs as well, because as Ms. McSween said, it of course it will have a major effect on family members, because you're looking at a situation where everything was good, everything was normal, and then this happened. You know, for some people out of the blue something like this happened. How do you deal with that? But then if what you're saying, that people are coming at the end stage and that this is their life, this is how they must be for the rest of their life, and they are looking at, well, it's only a matter of time until, if that is the case, then are we providing proper services to deal with that kind of acceptance as well? You know, because you know somebody is sick, but in the back of your mind you're still hoping and praying for a miracle, or you're still hoping and praying, you have faith that they're going to get better. Yeah. So how do we begin the conversation of how do I deal with, I have a family member that is probably going to pass away, and it's going to be hard, but the conversation has to happen. You know, because I don't see grief as something that you deal with after the fact. Grief for some people starts even before somebody dies.
Passed away, yes.
You know, so how do we start that conversation? Where or when is the appropriate time for us to start talking about our feelings, our emotions, and how we deal with things? Not just for chronic diseases, Ms. McSween, but on a daily basis. You know, how do we deal with situations? Because I see a lot of young people walking around with a lot of anger on their sleeves, and for me, I feel like there has to be more to this anger than just, you know, bare ignorance or anything like that. When we start having the conversation with young people, with older people, that it is okay to talk about your feelings.
Well, we have to start a conversation from childhood. There's no too early stage or too late stage, because if we think about it, in our culture, like we said, when it comes to anything psychological or mental, it's kind of taboo. I mean, over the years, there has been a great improvement in terms of the social services we provide for counseling for people and just mental health awareness and education. However, we still have people who have come from the old school socialization where you don't talk about your feelings, you internalize everything.
Yeah.
And so it's not easy to break from that. So we as humans, as parents, as teachers, as health professionals, we have to start the conversation at an early age, as soon as our children can understand, because a lot of things we deal with on a mental basis, it starts from when we're young. And take anger for example. Like, you'll have a child who start acting out for whatever reason, and you pay no attention to it, and they continue that way, and the anger just keep building and building, and there's no ways for them to resolve it. Because if you take children as an example, they don't know what to do with their emotions. When they feel a certain way, they're children. They don't know where to put it, how to express it. They might just act out, throw tantrums, whatever. We have to be very aware and observant of those things, and take steps. Talk about it. Encourage them to talk. Talk about your feelings. Express yourself. Because we know, as our culture, if you express yourself in a certain way as a child, then you're rude. You understand? Shut up! Don't say that. Or you don't answer me. You understand? We don't give children the avenue to express themselves.
Yeah.
So from an early age, different things build in terms of how we feel, how we think, and how we react to things. Because if you continue to tell a child, shut up, you can't say this, and you're being rude, or when I talk to you, don't answer me, don't give me back chat, and they internalize all those feelings that they cannot express. They grow with that.
Yeah.
And then sometimes it just takes something to trigger it. We have various stressors. Anything can stress you and trigger. And then again, we have to think that some people are genetically prone to mental health. Their family members might have suffered from it, etc. And then, so they're prone to it. So sometimes it just takes something as a chronic disease, or finding out that you have some kind of health problem that will trigger that, and then you will be more prone to suffering from mental illness or whatever the case might be, and not being able to deal with it.
Okay. Now that brings something to mind, and you may not be able to answer this question, but I think it's worth throwing out there for I don't know who in the Ministry of Health or whoever to consider taking Ms. Batiste's story into consideration. If there are, and I'll definitely try to find out if there are avenues where health professionals can seek counseling. Where they can, apart from talking to each other, where they can seek professional help. Because, as you said, Ms. Batiste, dealing with constant death is really not something that you should take lightly.
Yes.
Having this press on your mind, having to look at this issue, and it goes back to in the US right now, where we have COVID-19 and there are so many deaths, and you hear some of the nurses and so on speaking out, and how they can't handle it. Some have resigned because it has been so hard for them. So when you think about their situation, because I always tell people, no matter what profession someone works in, we have to take into consideration that there are people first. Police officers, nurses, doctors, there are people first. So they carry the same amount of emotions that we carry. They carry, and sometimes in most cases, they have more stressors than we have. They are more prone to mental health issues than we are in some cases. So we always have to look at these things when we look at scenarios. And I know sometimes we go, you would hear stories of people going to the general hospital and somebody snap at them and they're so vexed because you snap at them. But sometimes we don't really think that, listen, last night this person probably saw somebody that they were so close to die, or that they've been, seeing so much death and so experiencing so much grief over the past few months that it's all bottled up inside there, because we're really not good at expressing our feelings as a people. And I mean, sometimes I'm guilty of it, because my daughter, she's a preteen child, and trust me, very expressive. And I know who she get it from. So sometimes I shake my head and I say, Lord, cat really doesn't make dog. But it goes to show, because sometimes she would express herself and I would find myself getting upset. And I'm saying, but how can I get upset when she has expressed herself in a way that I can understand? Maybe the way she expressed herself came with a little bit of emotion, so it made her sound rude, or it made her sound upset, or it made her sound arrogant. But I can't fault her for the fact that she is able to express herself. And should I really be the one responsible for suppressing my child's emotion? So sometimes we have to have these kind of conversations with ourselves. How do we deal with expressing our emotions, but also to the person receiving those emotions that we're expressing? How do you receive them? What is the best way? Sometimes somebody may come to you and they may not want to tell you what's wrong, but they just want a shoulder to cry on. We have to be able to identify these things and just sit with them and not say anything.
And be able to listen, because in any when it comes to counseling, that's the first thing and the most important thing. You have to be able to actively listen. So sometimes it doesn't have to be a professional. You can have a friend for support, or a family member. And a lot of times as humans, we tend to like to talk a lot. We like to tell a person what to do or how they should feel. But we also have to be able to understand that sometimes I don't want you to tell me anything or what to do. I just want you to listen to me. Sometimes just unburdening yourself is just enough to make you feel that sense of relief that somebody listened to you. Sometimes that's all you need. You understand? And even like as parents, as you say, when our children express themselves, yes, we have to have certain limits, and you have to be able to talk to them. That's why you should have a conversation. Okay, you express yourself, that's okay. You can express yourself, but you just do it respectfully. Or sometimes, but then again, it depends on your interpretation, because as human beings, we're emotional. We are. So sometimes it comes with emotion, but then you have to be able to sit down and talk to people about, okay, when you feel a certain way, maybe you should try to at least calm yourself before you react in such anger. You understand? We always talk about breathing when it comes to dealing with our emotion, which is a very, very effective tool. And if people just take the time sometimes before you react, because as humans we're very reactive. So somebody tell you something, your emotions start at the same time. which is a normal thing. Anger is a normal emotion, but then you have to be able to regulate that emotion. And I do it with myself every day, because I'm not going to sit here and say I don't get angry.
Yeah.
I'm very quick tempered. But then, because I've learned and I've trained myself, because I'm knowledgeable of how you go about doing that, I am able to self-regulate. So if
Yeah.
I feel myself getting angry, I self-talk in my head, and people would say, okay, you're talking to yourself, you're crazy. No, you self-talk in your head, nobody have to hear you. You talk, okay, calm down. Take some breaths, sit down, calm, until you feel calm, or don't react right now. The people have to understand that when it comes to your mental health, it's not that you don't deal with a situation. Oftentimes people have the misconception that, okay, if I don't react immediately in that moment, then I've lost something, or I didn't win, or whatever the case might be. But you have to realize that as long as you talk about it, it could be in a relationship, it could be with your child, it could be with whoever. You calm yourself and you come back to it. You always talk about it, you address the situation, but when you are calm,
Right.
you understand?
Right. I definitely agree with that. And I've been seeing a lot of that recently on social media, where people are very emotionally reactive, where we react in a situation based on how we feel and not
Yeah.
necessarily based on the facts of the situation. And for me, it's something that I've had to learn over time. To just look at a situation and just be calm about it. And I mean, it's not something that I've mastered. Sometimes I do it. Sometimes I react emotionally to something.
It's not something that you master. I don't think so, because when it comes to composing yourself, like, I have to think and breathe and whatever. So it's not something that master. And I also think you made a good point when you said, like, in looking at our health professionals, like in terms of providing some kind of forum, some kind of training, whatever it is, for them to be able, if we put something in place, I say every month or every 3 months we will have some kind of professional come in, a psychologist, a counselor, whosoever, to talk about stress management, or to talk about depression, or to talk about whatever, because it's important to be able to help people, especially you dealing with chronically ill patients every day, and then they still have the personal issues, to be able to teach them how they can self-regulate, to first be able to be self-aware. You have to be self-aware. You have to know how you as an individual react. You have to know what your triggers are. You have to know what your stressors are, and you have to be able to regulate your emotions. So self-awareness is very important. And if we are able to teach our everybody, as well as especially our health professionals, that it might be a little easier on them. They might be able to deal with certain situations easier, and to be able to at least keep the mental aspect, the mental health, more stable.
Right. I agree with that. And of course, teaching our children that it's okay to express themselves, because a lot of times, especially in schools, a child will express themselves, and sometimes teachers, we fly off the handle.
I don't even want to start on that topic, because I'm very passionate about that topic, especially when it comes to education, because I think in our education system we focus basically on the academical part, academics and physical, and then the psychological part is out the door. We do not practice that. I really think that is something that we need to look at as a country, in terms of our educational system, because you find that teachers are not able to deal with children acting out, or to deal with children just being children, because sometimes as humans, which is normal, we bring our own personal issues, our own personal stresses, and then so when it comes to the educational system and the psychological aspect of helping children to deal with their emotions and to express themselves, we really stifle it.
I mean, it's something that I've experienced as well, being a teacher for so many years, but also it is something we learned. There's something called a hidden curriculum, which it is meant to embrace, or to teach children to embrace their feelings, their emotions, and it's something that we really don't, we're not aware of. Some teachers do it, but they're not aware that they're doing it. Whereas there are people who are educated about it, and they use it, and because they're aware of it. It is something that we have to hone in a lot more, because I am looking at the level of aggression in some of our young people these days, and I'm baffled. Sometimes I can't imagine what could make somebody so angry? You know, what could get you to such a place where, as you said, you can't self-regulate, where you can't step back from the moment and say, listen, this is not. So we end up in situations, and we end up in places we don't want to be, you know, just because we didn't take that moment to take a deep breath, as you said.
Yeah.
You know, so it really is something, Miss McSween, and I find we should have like a whole conversation surrounding this issue, because it's so big, you know, and it shows in society, especially when we have situations of violence and these kinds of things, and you wonder to yourself, how is it that two people can be friends and one person stabbing the other?
Not
Or
react
how
in
could it
such a way.
how could this happen? How could young people who grew up together, you know, played together, then turn into young people and fighting against each other? You know, you wonder these kinds of things.
Yeah, very much so. And I think a lot of the time in our profession we get accused of making excuses for people. That's what a lot of people would tell you. Like, you'll be having a conversation, this person did some reacted violently, stabbed somebody or killed somebody, and then you'll be having that conversation with someone and trying to explain what could have led to that in terms of the emotion and the mental capacity at that time, and they'll be like, all you're always trying to make excuses for people. It's not an excuse. That's why we have to be educated, and we have to be trained, and we have to learn for ourselves how to regulate ourselves, because the most important person in this, in terms of our mental health, first is us. Is knowing and learning and having the knowledge that, okay, there's certain steps we have to take to be able to help and manage our mental health. Because during school I learned this expression from one of my lecturers. Well, it's a psychological expression when it comes to mental health: emotional hijacking. That's how you call it. So in situations of where you see violence, especially where somebody might just snap and kill somebody or do something to somebody, our brain is very complex. So when you say emotional hijacking, it's a part of the brain where in a moment like that, you will just, that reasoning part of your brain will just shut down and you'll just react. And for some people, they will be aware of what they did, and for some people, they would not be aware. It's like they just shut down at that particular time. When they come back, it's like they don't understand what happened. They're not aware. You understand? So we have it's like I said, it's a big topic when it comes to our mental health.
I've heard stories like that, you know. I mean, now we can put a medical term to it, emotional hijacking. But you know, when somebody tell you they just see red or they just see black, you know, set in a situation,
part of the brain just shuts down and you just react. That's it.
Wow. I mean, we're learning a lot this morning about emotions and our the psychological aspect of our health. I mean, it's so much to take in. But I don't want to stray from Miss Batiste because she's been so quiet. She's been so quiet. And I mean, we have to take into consideration your mental health as well, dealing with these kinds of situations and these kinds of patients. And I'm sure you're not saying that you guys haven't had any losses, but it's how you guys deal with it, how you handle it as a team. Because being so small and so close-knit, I'm quite sure that you guys get emotionally involved with your patients. You know, they become like friends, they become like family. So how do you deal and how do you handle these situations?
Because you have to remember, these are people that we deal with every week. So it's basically like you going to work is the same coworkers every week you deal with, right? So we deal with these patients, we see them every week. Right, so obviously you get attached to them. You know, we sit and while they're on the machine, because they're on the machine for 3 to 4 hours. So while they're on the machine for 3 to 4 hours, there's conversations across the room. You know, everybody talking about their weekend. Everybody is, you know, talking about family and different things. And we get close. I mean, there's outside activities that we partake in with the patients that has nothing to do with dialysis or the clinic, you know. Just recently some of the staff members went hiking with the patients. So we are very attached to them. So when you say we lose someone, it also affects the family, But it also affects the staff member as well, especially if you get to see, if you witness that loss. And as I said, mentally, I wasn't able to deal with it. And you have to know that your points of strength and weaknesses, and be able to deal with it. But the sad part is that a lot of the times when you're going through certain emotional breakdowns and so on in life, you have people who would tell you, come on, you got to shake this off and keep going.
Right.
Not instead of, let's see how we can get you through this point, or do you need someone to talk to? A lot of the times people would tell you, come on, you got to shake this off and go back to work. Or, you got to deal with it. That's part of your job.
Wow. I mean, I don't even think I can fathom or even consider putting myself in your shoes, because I am awful when it comes to losing people. Like, it's just, and I don't even have to know the person that long, because for me, a life is something that is very precious, and when it's lost, you think to yourself, listen, am I doing everything that I've need to do in life? How much did I accomplish? If my life is snapped away now, where will my children be? What am I gonna miss? Am I where I'm supposed to be in life? And these are the things that you think about when you think about death. Sometimes every time I hear somebody my age dead, I want to go by the doctor and just check just to make sure that everything working how it's supposed to work,
So you see where the worry and anxiety comes in there, and some people are better able to regulate themselves than others.
I want us to talk about the financial aspect of it, because I know in Grenada, to talk about health insurance, we feel that health insurance is for the high end people in society. You have to be earning above a certain amount, and you have to be living a certain kind of life before you can consider health insurance or even life insurance at that matter. Are the people coming into your clinic, are they people who do you see people having life insurance or health insurance to help deal with the financial burden of this issue?
No. We currently only have one patient with health insurance. And what people don't understand is if you get health insurance and you come down with these chronic diseases and so on, it's so helpful, because we have one of the patients that is on dialysis right now has health insurance, and I believe, I don't do the accounting part, but I believe that the insurance pays like 60% of the treatment, and then the patient has to pay the 40%, which the between the government and the Kidney Foundation would help the patient with that 40% as well, right? So basically, you're looking at a patient whose treatment is basically almost fully covered,
right,
between insurance, government, and Kidney Foundation. So they probably just have to come up with maybe 10% or so of the treatment. So I think it's important for us to talk about health insurance. We need to stress it so that people can get more. I mean, they think that it's expensive. It's not expensive, Ms. Duncan. I mean, my health insurance per month, I pay less than $100.
Right.
And that covers myself and my son. Right? So that $100 you might go and spend at a party on a Saturday night. You can not go out on that Saturday night and take that $100 and put it towards health insurance. And a lot of people think that it's so expensive, but they just keep looking at the
and it's funny, people don't like to hear that kind of analogy. They don't like that kind of analogy because they take it to mean that you're trying to tell them how to spend their money. But I think what is most important to take away from all of this is that sacrifice is important, and we must weigh what our priorities are, what is most important to us, and not wait until we get into a situation before we identify, well, listen, I should have done this, or I could have done this better, because that sort of regret alone, along with dealing with an issue like that, could put such strain on your mental health. You have to deal with the fact that, listen, if I had to take better care of myself, I probably wouldn't be in this position. And on top of that, you're thinking about, boy, if I had to save more money and I had to take things more seriously, I could have been paying for this right now. It happens, because sometimes even me, who is I wouldn't say very stringent when it comes to saving and so on, but I try my best as much as I can. And sometimes situations happen and you find yourself saying, Lord, you know, if I didn't buy that shoes, I'd have had that money right now. You know, you put yourself, it's a frame of mind that you put yourself in. You cannot see the future. You can't see what is going to happen to you and what your health is going to be like in the future. But it's always good to be prepared. Like, for example, just recently I joined MASA.
Mm-hmm.
And I was having a conversation with one of my friends, and she said to me, well, why are you joining MASA? You don't have to go nowhere, healthy. You think? I said, listen to me. I am not going to take any chances when it comes to my health. You know, a while back in 2013, I had a pulmonary embolism. And for people who don't know what that is, it's a blood clot to the heart. You know, and I mean, I was a young, vibrant person moving, you know. I would never have thought that in just, and it was just a matter of days. I remember I was on work the Friday, my foot started to cramp, got swollen. No, it was a Wednesday. The Thursday was a holiday. And then I remember going to get the test done and going to do the Doppler, the X-ray of the leg and so on, and them saying that, oh, look, you have a blood clot in the left leg and you have to go to the hospital, and all of this is happening like clockwork, you know. And the Friday I'm lying in bed, the Saturday morning, in a matter of hours, I moved from just being a patient with a blood clot in the leg to being in ICU, you know, and wondering, listen, this is my life, you know. So sometimes it takes situations like that for us to wake up. But then again, sometimes you don't need a situation like that to wake up. You know, you could take my experience, my story, or many other stories out there of young people who in a matter of days or a matter of hours was just was given a wake-up call, basically, if you want to call it that. And you have to wonder, if I had to be flown out of Grenada, who was going to cover that cost? You know, if I have an incident where my children need to be airlifted out of Grenada to a hospital, who is going to cover that cost? You know, if I have to do a major surgery, if I don't have health insurance, who is going to cover that cost? You know, a lot of these things run through your mind in these situations. So that's why it's so important for us to start having these conversations, you know, and these things affect you, because I firmly believe, I mean, I laugh and I smile and I'm jolly a lot, but I firmly believe that experience for me, it really put a mental strain on me. Like, I am, and you could ask any of my friends and family members, and I do it to them as well, the slightest thing is doctor. I'm serious. I don't make a joke when it comes to health in these ways. The slightest thing, I advise, listen, go to the doctor. I don't make any...
You don't go and boil some bush.
Nope. No, I don't play with my health in that way at all. And it's from my experience. And I get a level of anxiety when these things... Even last night, my daughter was complaining her ear... A simple earache, she complaining her ear is hurting, she cried and so on. And at that moment, the only thing I could think about was getting her to a doctor. Like, I couldn't even care about the time at that point. It was getting her to a doctor, you know. So for me, it's something that I take so seriously.
It's a trigger for you.
It's a trigger for me.
You had that experience.
Because of the experience. It is a trigger for me. So that's why I always encourage people as much as possible to put their business in order.
Yes.
You know, I always say that, mind your business. And when I say mind your business, I mean stay out of people's drama and they mix up. I simply mean that too. But putting things in order to make sure that if something happens to you in life, that you can at least handle 50% of it.
Yes.
You know, you may not be able to get something that covers 100% of what you're doing, but 50% of it. It takes 50% of the stress off of you, you know. And that's why I asked about health insurance, because I don't think a lot of people, or enough people, have health insurance?
I don't think a lot of the population have health insurance. Let's put it like that.
Yeah, and that is definitely a conversation that needs to happen. And I'm seeing somebody in the comments here talking about national health insurance. And I remember when the conversation about national health insurance started, and they were looking at models. And I remember the Minister of Health making a statement when they were looking at models of how it's going to be paid for, because of course, you know, everything has to be paid for. It can't come free, especially in medicine.
Yes.
And you would know that things are expensive.
It is.
Because even though the patients pay $600 per treatment, you all have to think about staff and technicians and supplies and paying the doctors and the consultants and all of that, and it's a heavy cost.
It is.
You know, so we just look at it as what I pay in a doctor $150. That's a lot of money, you know. But then when the doctor looks at it, the doctor is saying, Lord, I really have to make this $150 stretch because I have to get X, Y, and Z. And you see, we have to kind of look at things
And we have to remember that a lot of healthcare professionals have loans. That's how they became healthcare professionals.
That too. That too. Because I always say we have to remember they are people first, you know.
Yep.
They had to eat, they had to sleep, they had to pay bills, they had to do all of these things. And just the same, we have to eat, sleep, and pay bills as well. So that's why it should be even more important for us to look at these things and not wait until water more than flour, and then we had to figure out, Lord, how I'm doing this, how I'm paying for this, and I have a student loan, but now I had this. And we are lucky here in Grenada to not have these exorbitant medical bills as people in some of those big countries like the US and so on, when you go in and your finger cut, and when you come back out you see a bill for $2,000 you know, and you wonder why I didn't just stay home and dress that for myself, you know. So we are lucky here in Grenada to not have that issue. However, it leads to an even bigger issue where our healthcare system is suffering as a result of it, you know, where we don't have enough funds being pumped into it to give us the kind of healthcare that we desire, you know. And I think that's where national health insurance becomes that big topic. You know, we have a caller on the line. Hi, good morning.
Good morning, Miss Duncan, and good morning to the two young ladies.
Morning, Miss Cammy.
I'm not hearing you all clearly because I'm not picking you up for the past few weeks. I'm not getting you good. But I'm still calling in and hearing you say this morning that you are two young ladies there. Good morning. I'm not hearing what all you're saying, but I'm saying good morning. And good morning to Grenada and Carriacou and Petit Martinique and all the Grenadians home and abroad. Good morning. You understand?
Yeah. Miss
So,
Cammy. Miss
but I'm
Cammy.
not hearing properly, so I just called to say good morning to Mr. Watts and Patty and to the Prime Minister and everybody in Grenada, Carriacou and Petit Martinique, okay?
Miss Cammy, before you
Yes,
go,
Dad.
what station are you listening on?
975 and 875.
And you're
I
not
don't think- but I'm not getting all you at all
okay.
properly.
Okay,
You
well,
understand?
yeah, well, we'll
So
look
sometimes I
into
just
it.
put on my phone
Mm-hmm.
and think, but anyhow, that's all right. But I
Okay.
just want to say good morning to everyone. Good morning to the Prime Minister
Yep.
this morning.
All
And to
right.
everybody, all in America, England, Mr. Deputy, and everybody. Right?
All right, Miss Cammy, you have a
And
lovely
one
day.
concern,
Mhm.
I would like that the people that want to play in jab, will you stop this thing? Stop doing this thing. It's not right.
Yep,
Okay?
yep.
And the people are encouraging them. If they love Grenada, they will not encourage them to play this jab to spread that disease. You know, Miss Duncan?
Yeah,
So you listen to this CNN
of
and to
course.
Sky News in England, and they're telling you how people are dying.
Yeah.
And you have people in Grenada that encouraging them.
Mm-hmm,
And you have some people that say they love Grenada and they don't love Grenada, they're pushing them. And they're ungrateful
Yeah.
to the Prime Minister. Even if you don't like him, Grenada is your country. Forget about the Prime Minister and love Grenada. You
Yeah.
understand? I don't want to call for one of them. But it's ungrateful. And that has hurt me. That has hurt my feelings. It's not right. Have a blessed day, everybody.
You too,
I'm
Miss
only sorry I
Cammy.
can't hear what's going on.
Yeah,
But
well,
anyhow, that is all right.
all right.
Have a blessed day, and things kind of all right. It's slow, but
Mm-hmm.
we hanging in there.
Okay.
And we bless.
Okay.
We are blessed people in this little country of ours.
We are.
Look at the little things we have. I have a lot of cane this morning. Cane. In on the terminal. Have a blessed day, everybody.
You
And
too,
young
Miss
lady,
Cam.
keep on doing what you're doing as young people.
Yes.
Bye-bye. Have a blessed day.
All right.
Bye-bye, Miss Duncan.
Bye, Miss
And
Cammy.
Sharon Scott, good morning.
Yes, he
Morning,
listening. I
Sharon.
sure he hear you.
All right, and Mr. Bola.
Yes.
You are listening. I can hear you.
All right.
Bye-bye.
Bye-bye.
Yeah.
Yes, that's Miss Cammy. She's one of our regulars. Miss Cammy, I don't know what happening with you, but if there's anyone else out there who's having that problem, then give us a call and let us know, because we want to make sure that it's fixed. And if it's an isolated issue, then Miss Cammy, maybe we might need to come and give you a little hand in getting better reception there on the terminus, right? But ladies, we winding down for time, but I just want to say thank you for taking the time, for reaching out, because for me, and I'm speaking personally now, I think that these are topics that are so important that we need to spend so much time talking about, because it is something that is prevalent in society, and maybe we don't hear about it enough because the patients themselves don't speak about it as much as we would like them to give their personal experiences and so on. And maybe we need to encourage more people to speak out about these issues, to speak out about these problems, because it doesn't just affect them, but it affects us as a whole. You know, when you hear of somebody with a chronic illness and you think, oh well, that's that person's problem, I mean, it really isn't. It's all of our problem, because there is a trigger, there is a reason why this is happening, there is a reason why this is so prevalent. And if we can start telling our stories, if we can start talking more about these issues, maybe we can find the commonalities so that we can really address what the problem is. Whether the problem may be alcohol, whether the problem may be diet, whether the problem may be physical activity or lack thereof. Whatever these situations are, if we start talking, if we start sharing our stories and sharing our experiences, then maybe we can meet at a middle ground and say, listen, you and I have this in common, or 5 of us have this in common. Maybe this is something that we need to look at seriously, you know, and get away from the taboo of feeling like my personal problem is just my personal problem, you know, and that my emotional situation is just my emotional situation and it just affects me. You know, we often hear the cries of, all you don't know how I'm feeling, you know, but we can't know how you're feeling if you don't express that to us, you know. But it also takes us, it gives way for us to start the conversation of having real empathy for a situation. You know, whether we're talking about kidney disease today, cancer tomorrow, sexually transmitted diseases, whatever it is, the empathy has to be there, because it could be any one of us at any given time. We just don't know what our fate is. Because you could be healthy as a horse today and go and do a test. I have a cousin who, she's only about 25, and 2 weeks ago had a stroke, you know, and well, I done explain all this to my situation to you guys already, because I ready to go by the doctor or ready to get checked, because her cholesterol is high. And you know, usually when your cholesterol is high, there are no symptoms that tell you my cholesterol is high. You know, sometimes you may get some chest pain, or it just goes from high cholesterol straight to stroke, you know, or high cholesterol straight to heart disease. There is no middle ground in some of these instances. So the conversation of better health, better eating, better physical activities, and these sorts of things, it needs to move from being a taboo, and it needs to be open conversation, open discussion. I always say sometimes we spend so much time jumping up in all kind of politics and all kind of nonsense, and we don't spend time thinking about us. You know, taking care of us, our mental health, you know, our physical health. We don't take time to do that. And I think these conversations are very, very important in dealing with chronic illnesses, and how we address them. You know, what avenues are available for me to now go and get checked for me to find out, listen, my mother has high blood pressure, my sister have high blood pressure, my father have high blood pressure, so I had to look out for high blood pressure. And we're not thinking about what else other than high blood pressure do I need to look out for. You know, do I need to be concerned because since there's a history, I may have kidney disease or I am prone to kidney disease, and what can I do to slow an onset or to cancel it altogether? You know, and these are conversations that we need to start having. So I'm really happy that you guys took the time to come here today and sit with me and just have this open conversation about kidney disease, about the opportunities that are available through Island Health Services to do that. And of course, Ms. McSween, as always, I am an advocate for talking about mental health, you know, and for us to have open and honest conversations about it, and for us to take taboo away of feeling like this is an isolated issue or that is an isolated issue, and not tackle full on that there are people out there who really do struggle with mental health, whether in a small or large capacity.
Very
You
much
know, and we need to start being educated on that, you know, identifying these things, because it could be somebody right in our home and we don't know.
Yeah, I think
Yep.
it's important for us to to educate people on the mental health, so they are able to recognize the signs and symptoms that they may be going through something, they're having an issue in terms
Yeah.
of their mental capabilities or whatever it might be. Because you could find yourself being like a outgoing person, whatever the case might be, and all of a sudden you find yourself like you just want to stay home, you cut all ties from people, you don't call your friends, if somebody's calling you ignore the call, you just want to lay in bed all day. Those are all signs and symptoms that you're going through something. And it's important to also know that even if you are suffering with chronic disease, it doesn't necessarily mean that you'll have mental health issues, because some people are more resilient than some.
Right.
So having a little feeling a little low energy or feeling down or whatever, that is normal. We're humans, we go through those things. Sometimes something you just have a little low mood or a little low energy, but if it's something that persists for a long period of time, then you know that you have an issue. So you have to be able to look at your signs and symptoms to know
Yeah.
that something is wrong, when you should talk to somebody, when you should seek help. But you also have to be careful about who you're talking to, because there are a lot of times that people you talk to will be more negative than positive, and that
Yeah.
does not help the situation. You
Yeah.
have to find people and surround yourself with people who will motivate you, who will be a positive
Absolutely.
influence instead of just being negative.
Absolutely.
You know, that makes the situation worse. So it's all about educating ourselves and being more knowledgeable about things like that, so we're able for ourselves to do some self-checks and say, okay, you know what, I need to check this, or I need to, okay, so let me get up, I need some exercise. Even exercise help us to feel better.
Yeah.
If we find ourselves
Yeah.
becoming so, like even this time with COVID, it have a lot of people who are suffering in terms of, because some people are better able to deal with restrictions and isolation and whatever. Although I think in Grenada, there's not so much as isolation to talk about.
Yeah.
Because we have various things, but that's where the negative thinking and the positive thinking
Yeah.
comes in, because you'll be, okay, well, I can't do this and this is restricted, and you have all these negative things, it's another negatives on you, make yourself anxious, you stress out yourself, instead of you looking at, oh, well, we don't have any COVID in Grenada, we're very lucky to have big yards we can run around in, our
Yeah.
mango trees to go on get some fruits, our small kitchen gardens around our home that we can tend to. We have a lot of things to do that will help us out instead of we sticking in a situation where we get depressed or so anxious. But as humans, we tend to go towards the negative. So we have to learn, and we
Yeah.
have to educate, and we have to practice, so we can make ourselves better able to deal with our mental health.
Of course, and in teaching, we learn about the social learning theory, where a lot of practices, a lot of norms are things that we inherit,
Yep.
behaviors that we inherit from society, from people that we look at and people that we interact with.
Yes.
And sometimes when you look at children, you wonder, well, how that child gets so. You have to look at yourself, because a lot of the behaviors that children adapt is things that are learned
model it.
from. Exactly.
Yeah.
So it definitely is a big conversation that needs to happen. But Ms. Batiste, I'll give you these last few minutes to just give us some contact information about the for the clinic, and also to let us know when the clinic starts on Saturday, this Saturday, and give us some more information just quickly about the time and so on.
Okay. So if anybody is interested in attending the renal chronic disease clinic, it's whether you've already been staged with renal disease, or you probably don't have renal disease, but you're suffering from hypertension, you're suffering from diabetes, polycystic kidney disease. You can give us a call at 439-9474 and book an appointment for our renal disease clinic. And the receptionist will give you a time slot for Saturday.
For Saturday. Okay, and if I'm already suffering and I need to enroll is probably not the right word, register for dialysis treatment, I would call the same number.
Yes.
Okay, wonderful. Well, ladies, see, look how easy that was, and the time is already gone, and you guys were so nervous. But it really was a pleasure, and I'm sure that the listening audience is better educated and is happy for this information that you guys have given us here today, and this conversation that we have had that would hopefully trigger more conversations surrounding these issues, so that we can better educate ourselves on some of the things that are happening just right around us,
Yes.
So I'm really happy that you guys took the time to sit with us and to discuss with us all of these wonderful, wonderful initiatives that you guys are involved in. And I'm always happy when I see young people like myself engaging themselves in positivity,
Yes.
Things that can help change society and bring about change in people in society. It always makes me very happy, So I want to just encourage you to, no matter what, sometimes when you grow and when you begin to grow is when you see the most challenges and when you see the most fight down, as we call it in Grenada. But one thing I always say is that I am very goal oriented. So no matter how many obstacles come my way, my eyes are set on a specific goal and I must reach that goal.
Yes.
And I aspire that for many of the young people that we have in Grenada, that when you do something, you do it to the best of your ability, regardless, of what that thing is, or for however long you plan to be in that situation. It should never be done in a mediocre form, but we must always aspire for greatness. So I'm very happy that you guys are here and that you guys have taken up this mantle to just inform and educate the population on these things. But guys, as you know, we are out of time already. So it's always a pleasure being here with you guys. In whatever you say and whatever you do, be safe and be secure. I always want to be talking with you. I don't ever want to be talking about you. Please do enjoy the remainder of your day and stay tuned for the National Report.
Upper House passes COVID-19 cancellation of Carnival bill. Details to this story and more in the National Report. Welcome back. With the details to the news for Friday, July 31st, 2020, I'm Delroy Lozan. The Upper House on Friday passed the COVID-19 cancellation of Carnival August Celebrations Bill 2020. The bill was presented by Culture Minister Senator Nolan Cox, who said cancelling Carnival will put government on the right side of history. Senator Cox said although Carnival generates revenue and is a time when people enjoy themselves, Grenada cannot let its guard down during this period of COVID-19. The newness of COVID-19, he said, keeps presenting strange challenges that governments must deal with.
We know that the lives
Grenada confirms 24th case of COVID-19. Government maintains its first priority is protection of the lives of people. We'll have details to this story and more in the National Report. Welcome back. With the details to the news for Wednesday, July 29th, 2020, I am Rikisha St. Louis. Grenada has confirmed its 24th COVID-19 case. The confirmation from the country's Minister for Health, Honorable Nicholas Steele, during his ministerial statement at Wednesday's meeting of the House of Representatives. Minister Steele says the positive test was returned from a passenger who came to the island on the chartered JetBlue flight last week. He said other tests were conducted and the ministry is awaiting the results.
Regrettably, I have received confirmation as well, a text while speaking, that yes, we do have one more positive case in quarantine. And regrettably, there are other results that are pending that may also be positive, but most definitely one more. So we are now at 24, Mr. Speaker.
This is the island's first confirmed case of the virus in 6 weeks. Recently, 3 Trinidad nationals who resided in Grenada tested positive on arrival in Trinidad. However, after a series of tests, they were all confirmed negative. The ministry also conducted contact tracing on 150 Grenadians who were in contact with the 3 individuals who initially tested positive. Minister Steele says government will continue to implement stringent measures to ensure the safety of citizens and limit the number of cases.
All of our neighbors who considered opening and having regular flights during this difficult time have had to step back on that. Either step back completely or put more stricter levels of enforcement on or screening. Quarantine is a necessary evil. I say evil, yes, because it does hurt for individuals to be finally home on Grenadian soil, but then have to be in quarantine. And Mr. Speaker, we are seeing, I use the example of British Virgin Islands, where they've relied significantly on an honor system for their nationals returning to remain in quarantine. And within 2 weeks of implementing that system recently, their number of cases doubled. So that is why we are putting these stringent measures in place.
The House of Representatives has passed the COVID-19 cancellation of Carnival August Celebrations Bill 2020. Prime Minister Dr. The Right Honorable Keith Mitchell, who brought the bill before the House, acknowledges that while it is in Grenada's best interest financially to have Carnival, their priority now remains to protect the lives of people. Dr. Mitchell pointed out that Grenada has had 3 months of no productivity and there is a serious drop in the country's fiscal situation. He said they cannot at this time reverse the gains that they have made through fiscal responsibility, which has resulted in more support for Grenada than any other country in the region.
I am convinced, Mr. Speaker, to have a holiday is to encourage people to have masks, to encourage people to jab in the thousands and the hundreds and the tens, and we have got major problem because with the border opening, more people will be coming from different parts, and you never know. As the minister pointed out, one came in with a positive test a few days ago. That one person can go into a celebration on the beach and infect 20 and 30 people. Then 20 and 30 people go out in the villages and infect hundreds. Where are the beds in the hospital for 100 ICU patients? We in government, if we allow that, we better run from town because people will deal with us accordingly.
Giving her support to the bill, Tourism and Civil Aviation Minister Dr. Clarice Modeste Kerwin says while Carnival has made Grenada a serious destination competitor, good sense must prevail. Providing statistics, she said in 2018, 12,379 visitors came to Grenada during the carnival period, and that figure represented a dramatic increase over 2017. In 2019, 13,327 visitors came to our shores, and some of those who came back for last year's celebration had already started booking for 2020.
I want to beg that we continue on the trajectory that we are on, the path that we have carved as a nation, because every one of us makes sacrifices. And let us not throw those sacrifices down the drain. As much as we like Carnival, as much as it does for the economy, I would beg everyone, let us comply, let us leave the job for a while. Next year it's going to be bigger, it's going to be better for us, but we have to make the sacrifice now.
Minister for Health, Honorable Nicholas Steele, appealed for common sense so as not to reverse the sacrifices made. He says tabling the bill is not the desire of a cruel authoritarian government, nor is it political policy, but is instead a decision guided by scientific facts.
We are no different than any of the responsible governments that recognize that mass events will cause the spread of COVID-19. And for those who say, well, we don't have no COVID in Grenada right now, I don't know that for a fact, and I'm the Minister of Health. And we as a responsible government are not prepared to play Russian roulette with the population. So, Mr. Speaker, my final words too is that there are some out there who are provoking this, but they themselves will stay home. They themselves are wearing the mask. They are provoking this just to see civil disorder because it's not their watch. Well, this is our watch, and we have to do the responsible thing, Mr. Speaker.
Leader of the opposition, Tobias Clement, also threw his support behind the bill. He said in a situation like this, education is critical.
We have to continue to educate our people in the virulence of COVID-19. It's not to be played with. It's not to be trifled with, especially in this time.
This is the National Report. We'll have more news after the break.
The house was shaking. Then suddenly saw we hear bang, crack, and the roof had gone.
Man, I was so scared, I nearly wet myself.
Only those who have lived it can truly understand the devastating fury of a hurricane's wind.
The house across the road just get up and roll over.
Hurricane force wind. It's a hazard. Hazards. Take control. Reduce your loss. You can hurricane-proof your home. For example, make your roof more wind-resistant by using screws instead of nails in its construction. Find out more about hurricane force winds and other hazards at your local disaster office.
A message from the National Disaster Management Agency and SEDERA.
Welcome back. Clerk of Parliament Andrew Augustine is seeking to clear the air on the process of asking questions and providing responses to questions in Parliament. Augustine explained that there are two types of questions that are posed in Parliament, urgent and regular. Urgent questions require an oral answer, while regular questions require research and data, and responses are submitted in writing. GIS sought an explanation from the clerk after comments were made by some on social media accusing the government of refusing to answer questions posed by the leader of the opposition, Tobias Clement.
The leader of the opposition may submit what is called an urgent question, and an urgent question is a question that the expectation is that the minister on the other side or the other MP would have that information at his or her disposal, which is different from regular questions, which would require some more in-depth research and the finding of information which is not readily at that person's disposal. So for regular questions, the criteria and determination is Is that information readily available, or is there a reasonable expectation that that MP would have that information? And the Speaker is the one who finally makes that determination based upon the context in which the question is asked. So a question which requires data would be a regular question. A question which does not require data, but which requires statement of fact about something else could be an urgent question.
According to Parliament procedures, questions go into the office of the Clerk of Parliament first, then go through the proper channels for an appropriate response. If the question is submitted at one sitting of the House, then it is expected to be answered at the next sitting, which can be a month apart.
The clerk will disseminate the question to the relevant ministry on behalf of the leader of the opposition, and the ministries will begin working on facilitating the answers for the MP. That's a general expectation. It will be reasonable to expect that a regular question, the answer may be given at the next sitting of the House or the next sitting of the Senate, whichever one. Where that question those questions were asked.
Provisions are also made for answers to be submitted before the 30-day period.
For example, we had a question today where the answer was supplied, or the regular question, but some of it was supplied even prior. The Minister of Agriculture already sent in answers to questions, which is deemed to be a regular question, and that happened within a 7-day period. So if the minister has the answers readily available in terms of data, they may submit it sooner. It doesn't have to be the next meeting of the House. Whenever they send these answers in, the clerk now makes it available to the leader of the opposition. So the clerk does not have to wait till the next meeting for the answer to be presented to the leader of the opposition. As soon as it comes in, that answer goes to him or her so that they could do the evaluation and, if necessary, submit further questions.
Prime Minister Dr. The Right Honorable Keith Mitchell said government's sole responsibility during the COVID-19 era is to protect the people. Dr. Mitchell was speaking during Wednesday's sitting of the House of Representatives. He was addressing the proposed Coronavirus COVID-19 Control Bill 2020, which was to be tabled in Parliament on Wednesday, but government, listening to the concerns of the people, has agreed to embark on a formal public consultation process. The proposed bill was intended to protect the people, especially now that the decision has been taken to reopen the borders. Dr. Mitchell said if government drops its guard and more cases are contracted, which results in death, government will never be forgiven.
Do not forget that our duty first and foremost is to protect the people of this country. Mr. Speaker, if we don't, and we fall prey to some little political licks here and there, and we drop our guard, and with the border opening and people start being infected and they die on our watch, with the 5 or 6 ICU beds we have there that cannot cope with more than that, you will not hear the last of it. The same persons who might be down on us today for attempting to protect this country would be the ones, would be the loudest one. You kill my brother, you kill my sister, you kill my cousin.
Organizations have rallied the support of members of the public to protest against the tabling of the bill. On Wednesday, protesters gathered outside the Parliament building at Mount Welldale. Dr. Mitchell said no action will be taken against these individuals as it is in their democratic right to freely express their opinion.
This country is a very strong democracy, and we must not be afraid to accept demonstration here and there. While we're not encouraging it, but if it happens, that is part of the democratic process. We won't be seeing people being hauled in the streets and put away into jails and some of the things we see coming from abroad. We won't see that. Yeah, people's right to express themselves is their right.
That story just ended the national report for today, Wednesday, July 29th. Recapping the top story. Grenada confirms 24th case of COVID-19, and government maintains its first priority is protecting the lives of people. On behalf of the entire news team here at the Government Information Service, I am Rikisha St. Louis saying thank you for joining us. Until next time.